In the next 180 seconds, discover the only way your practice will survive in the accountable care age. See how you can beat declining reimbursements, guarantee higher margins, and profit from accountable care. But first, you must know the sad truth about these three things. 1. The state of the United States healthcare system. 2. The fate of independent optometry. And 3. What it will take to survive in the accountable care age. In the next 3 to 5 years, these truths will determine how or if you practice optometry. We spend a lot on healthcare, 2.5 times more than the next closest country. It's roughly $2.1 trillion, or enough to give every man, woman, and child in our country over $6,700 a year for healthcare costs. But there's more. At the current rates, in 36 years from now, the costs for Medicare, Medicaid, and Social Security will bankrupt our system. Change is coming, and it looks a lot like the Affordable Care Act. These two new healthcare models are supposed to control costs and increase access of care to 20 million Americans. And these organizations have skyrocketing growth with no signs of slowing down anytime soon. Experts are saying that the ACO could forever revolutionize the way healthcare is practiced and paid for in the US, and it could mark the beginning of the end for fee-for-service. The vast majority of your patients will eventually be shuffled into closed groups of closely working medical providers, and these groups will not be paid solely or at all by fee-for-service. So where does that leave optometrists? Well, how much does the medical community care about optometry? Not much. What happens if you're not in that group? The fate of independent optometry. We're looking at decreased exam reimbursements because these retail companies profit so much from materials that they can use low-cost vision plans like VSP and IMED as a loss leader to sell their products. And in general, these companies are driving down market prices for materials because they get better margins and do huge volume than any independent OD ever could. We also have new low-cost threats that are on the horizon. Specsavers, do your research. You'll see what a mess that made out of the UK. We also have the expansion of online retailers, which no one's surprised about. The main takeaways here: within the next 3 to 5 years, your income from exams and materials will be significantly less, and medical eye care cannot save you unless you're part of a larger group like an ACO or a patient-centered medical home. But do you know how to contract with one? How can an OD survive? There's one simple solution to all these problems, and it's unity. None of us is as strong as all of us. Collectively, we've discovered how to sell our own plans so that we can set the fees. We know how to lower our cost of goods. We can make more profit and take back our industry. For the rest of this video and more information about how exactly you can thrive in the accountable care age, visit nyipa.org and sign up for more information about becoming a member. Your practice literally depends on it.